right, the first thing to do is to expose the appropriate part. I was examining the spine standing. Okay, so if you look at talk about spinal balance and everything else that we talked about earlier, you're much easier to examine the spine, see how it moves standing. So the first thing I'm going to do, if I face the camera, I'm going to turn around. So turn around like this. Okay. So the first thing I do is to just see how it's. Can you bring your legs about standing distance apart? So what you want is even distance apart. So what you can see is that, say, are the leg lengths equal? Is the pelvis level? Sorry, Kishan.
It's all right.
Okay. And is his head balanced over the middle of his sacrum and pelvis? Okay. So if his spine is like that, that's a trunk shift, isn't it? And if it's like that, it goes the other way. So you can see to which side the balance goes. So you say a trunk shift to the right, you can measure it with a plumb line, and then you can actually sort of decide. You can actually say how far it's gone. You can describe it centimeters, inches, or whatever else you want to. So he's got a relatively balanced spine. This is the coronal plane. Okay. The other thing you're looking at is relative rotation. So look at his pelvis. Look at the shoulders. Do they rotate? Do they balance up? Or is one twisted on another? Okay. Look at the sagittal profile. So you come to go this way like this. Okay. So what you should have here is a natural thoracic kyphosis, a lumbar lordosis to compensate, and a cervical lordosis here, and the head should be balanced over the middle of his sacrum pelvis. Okay. He shouldn't be leaning forward like that, or overly balanced back, or whatever else like that. It should be an even balance. Okay? Right, if you turn me back to me like this. Always have the whole spine exposed. Okay? So you can look to see, so you look basically, if you look at this, Kishan, do you have a slight bend in your spine?
Didn't know about it, but maybe.
And, sometimes you can see subtle things. So I wonder if you might have a very subtle bend. So this should be here and straight. Does he have a very subtle bend? What we call a minor scoliosis. Okay, to the back. Okay? Don't worry, they're normal.
Yeah.
Okay, so, okay. One of the things to see if you think there's a bend like that, does it alter shape with rotation? So what you want to do is bend forward slightly. When you do an Adams test like this, just to 90 degrees like that, and you look, okay? Now, I don't know if any of you can see this, but this left rib cage here is slightly higher than the right one.
Yeah.
You've got some bend in your back, mate. Okay?
Can you see it?
So there you go. And if you want to get a spirit level, you can put it on it. No, it's according to degree. It's known as a Bunnell. The Bunnell is the degree of twist, and there's a thing called a Bunnell-ometer, which is like a fancy spirit level, which tells you how much twist. So Kishan's got a twist to his spine, very subtle, and you can see the spine drifts a little bit this way when he does it. Okay, up we come. So you want to say if there's a curve to the back, the primary curve's here, left-sided in the thoracolumbar spine. Okay? That probably happened when you grew, when you're about 14, 15 or something else like that.
Maybe.
Sorry, I'm making you sweat like that.
Yeah, no, it's really hot. I'm worried now. There's a scar as well, which was a problem with I sliced myself in a window.
Hard to see, mate.
Okay.
Okay, so you can comment about moles, hairy patches, bits and pieces, cafe au lait spots, things that might signify something like all these sorts of things like that. Hairy patches at the base of the spine, it's a spina bifida or anything else like that. Do they signify much? I'm not sure they do. What I intend to do is just to feel the base of the spine, roughly the level of one's pelvic iliac crest denotes L4-5. So L4-5 is around about there. Okay, so there's the spinous process midline, just either side L4-5 facet joint. If you swing your thumbs down, you'd be over about L5, there's one down there. Okay. Now, I can't see his face. You'll have to say, is that painful or tender or not?
That's right.
That's all right. If I run just out to the side, you'll see this area here, you can feel it. So we call it the sacral dimple. There's nothing to do with the sacrum at all. This is equivalent to this. This is the posterior superior iliac spine of the pelvis. So when people look at this, look, that's what you feel. Your sacrum's a bit further down, isn't it? Okay? And attached there are your paraspinal muscle groups, like that. And you can say sometimes you can roll that tendon as it comes in there, that enthesis. Okay? And if it's painful, they'll tell you about it. Okay? Right, so you can actually just feel up the spine as you want to go, like that. Some people thump it. I don't like thumping things. I think it's usually, you know, if it's tender, you know about it. Right, movement. So I've looked, I felt, I'm going to move. Okay. So how far can you? So can you touch your toes to me? How far can you go? So he's quite flexible. What you want to see though is how much is hip, okay, and how much is spine. So gently do that, and you see his spine moves quite a bit. Okay. You can actually put your fingers on a couple of these spinous processes. Up you come, and you can see it moves a fair bit. What you're also looking for is the spinal rhythm. Does he move evenly up and down? Does it go in a straight line quite normally, or does he twist? Does he walk up his legs? Does he hold himself? Does he get some of the, oh, that hurts, or what have you? Then you want to lean back. Lean back for me. Okay. So in terms of extension, he cheats with his legs a little bit. You're a little bit stiff there. You'd probably say relative to here, maybe 20 degrees or something else like that. You could see an extension. Then you go lateral flexion on each side, so you can go to the right side like that, and go to the left side. Right. As we've noticed a slight twist in the spine here, what you want to do is go to the left side. Does it correct? Does it straighten out? And it probably does a bit. And go to the other side, and does it increase? And what about the other bits that correct below? If I want to load the facet joints, I'll lean in backwards. Sounds great. Okay. Okay. And then keep leaning backwards. Don't remember to support it. Don't want to lean on the floor. Now twist and go that way, and go that way, and you'll particularly grind the facet joints. Okay. If I want to strain his muscles here, if you lean forward, sometimes you can lean into one way or another if you want to really test those muscle groups. Okay. The other one's rotation. Tend not to usually test rotation very much, but you can put your hand on the pelvis like that and twist twist to the, there you go. So he twists his pelvis a lot, and there you go. So there's not too much rotation. One thing I was going to comment on, and you can see this, if I look at his pelvis here and his shoulders here, you can actually see there's a very small touch of rotation to his shoulders relative, probably about 5 degrees. Okay, so it's relative to that. So that basically is his spine, is his spine examination done. If you think there might be a leg length problem, okay, which causes that, the best way to do it is to get rid of leg length problems is to sit down. So if I get to sit on the other side of the couch like this,
oh yeah, okay,
just for demonstration purposes. So now we sat down, okay, leg lengths are out of the way. Okay, so that's no longer an issue, and you can see there's still a little twist to his spine like that. Okay, so you know that it's from the spine, it's not secondary to a leg length problem. Okay, right, there you go.
thanks.
I'm going to pop this, I haven't finished it yet.
Oh,
Okay, nice up, right. Then I find the easiest thing is to lie flat. So basically, effectively, I've done the thoracic and the lumbar spine. I've not really moved his neck. I'll do that at a separate stage. What I always do here is it's very important to do not forget effectively hips and knees on your spinal movement. Okay. So the first thing you're going to do is do this. What I tend to do is you put your hands down by your side. Check your leg lengths first. Okay. So the best way to square the pelvis is see where the anterior superior iliac spine is. It's the first bony prominence you come up to from below. When you feel it, you can put your hand across it like that, square that up, and you see it's relatively square, and his leg lengths are equal. Okay? Alright? Bend the knee, give the hip a twist, and look at the face the whole time. Okay? So you see he's not wincing or anything else, and the hip moves fairly well. And that's what we're doing here like that. Okay? Okay? Right. You may find that somebody with a stiff hip you get so far, they get a lot of back pain if they've got back trouble, because effectively it's the pelvis that's moving and then the spine moves. Okay? So what you've got to discern is what is pain from the hip and what's actually sometimes pain from the spine. And sometimes if you've got a painful spine with a stiff hip and nerve root pain, you may even get root pain coming down the leg. So this is where your examination, you see what moves and what doesn't. His hips move quite well. What we're going to do is a straight leg raise, okay? The science behind the straight leg raise is this. If I straight leg raise to 90 degrees, your nerve roots are going to move about 2 centimeters in your spine. So some people only get so far because their hamstrings are tight, okay? And others, if they start getting leg pain or nerve pain down it, it means the nerve is usually pinned, okay? So if I do this, what I tend to do is just rest the leg like this and gently lift it up. Keep an eye on the face and gently does it. Feel that's probably as far as he's going to go, okay? And then what you do the next thing, just gently sort of pull the foot up like that, give it a final stretch. The fancy name for that is a lasag, okay? It's other we just call it a sciatic stretch test, okay? Another fancy test, you can bend the knee, put your hand, put your thumb behind, so where the sciatic nerve runs, and then stretch it that way. That's another way of doing it, and you can aggravate it down there. But the best way is just a straight leg raise. So if you do this one, similar, okay, so similar to about 80 degrees as it goes, and if you stretch, there's nothing coming down the leg doing that, okay. I do femoral stretch tests lying on the front. It's easier, okay. No, not yet, not yet. So when you look at when you do that, okay, I've got him lying on his back. If somebody's elderly and frail, you don't want to keep them turning over. So it's easy to do the rest of it now and then do the other bits on the front, okay. So the thing to do here, if you want to, so basically running through the muscle groups to test, what I tend to do here is straighten your knee for me, hard as you can, and push. Okay, like that, straight as hard as you can, stop me bending it.
That's my fracture my medial femoral condyle and the lateral meniscus in that one as
okay.
well, so no. So go easy on the knees.
Straight hard as you can, and hold it. So what you're trying to get them to tighten, hold it as hard as you can like that,
yeah.
Okay, and stop you bending it. That's the easiest way, relaxing it. Now if you can test the hamstrings, just pull your heel towards your bottom, hard as you can like that, okay, like this. Do the same on the other side, straighten the knee, keep it straight, hard as you can, there you go. Now bend the knee, pull your heel towards your bottom, okay, like that. Pull your toes towards your face. So this is a good test of the L5 nerve root, isn't it? All those dorsiflexors and everything else, particularly EHL. Okay, pull up as hard as you can, stop me putting it, and you can just gently balance on it like that. Push down to the floor, push on me, up she goes. So this is S1 innervated, L5 innervated. If you really want to test the everters, pull your foot against my hand out that way, and you can push it in. Okay, you can do pull out and push in like that. But usually, if this goes up and that goes down, normally the rest will. Okay. Testing sensation. Okay.
These are Leicester students.
Okay, that's fine. Testing sensation. Remember your dermatomes. Okay. The ilioinguinal nerve only supplies over here. Well, if he's a bit numb, that's what L1 supplies. Doesn't really matter. So if you look at it, test both sides. So, sorry. So if you can, L2 is this one. So that feel normal. Okay. Yes, you can go at it. In the clinic, it's quite easy. Just to you can actually ask your examiner, so would you rather be more specific? You can do 2-point discrimination. You can do light touch. Pinprick, all that type of stuff. The easiest things you're running around it in the clinic is to do this. So you feel that's normal. This is L3 over the side. Okay, so that's normal here. And remember, L3 dermatome comes over the knee like that. If you've got a problem just up here, and this is normal, this is much more likely to be lateral cutaneous nerve of the thigh territory. And where the lateral cutaneous nerve of the thigh runs, if you go look at the anterior superior iliac spine, just a little bit in of it, that's where it comes through the inguinal ligament. Okay, so it's a differentiation between what is peripheral nerve and what is nerve root. Okay,
L4 territory is always this answer, is the saphenous branch of the femoral nerve which supplies this bit down here. L5 root is the common peroneal nerve and branches, which is here, okay, on the side of the calf, top of the foot, and also don't get underneath it like that, okay, all the way around it like that. And the L5 root, if you get pain going into the big toe, that's nearly always L5 root. If you get pain going into the lesser toe side of it, that's nearly always S1. The S1 on the foot is the lateral border like that. Okay, I don't have a tendon hammer, but basically, if you're gonna, the way I test reflexes, you've got to get the patient relaxed. So what I tend to do is just let it go, let me take the weight of it like that, and then you don't have to whack him hard. I can even do it with my fingers. Look, I can get a twitch out even with my fingers. So you've got to be gentle, okay? Don't hurt people when you examine them. Look at the face, because if you hurt people, they will fail you. If you do inadvertently cause a bit of discomfort, say, I'm really sorry, and your examiner will forgive you because at least you're, and a lot of painful joints, you're always going to cause sometimes a little bit of discomfort anyway, but to be gentle and know how far to take it. So look at the other side, relax me, let it go. Look, I can do that one there. I tend to find the easiest way to do the ankle jerk here. So effectively, this is a quads problem, okay, L3 and L4 root. This is purely a calf thing, the ankle jerk, which is an S1 root, okay. So you get that one, L5 S1 disc prolapse, squashes the S1 root. What reflex is going to go? It's the ankle jerk. So if I do this, tend to just dorsiflex it like that, and then you press on it. You hit it just gently like that, and there you go, like that. And obviously at the same time, your planters what tend to do is just scrape up under the underside of the foot like that, and the toes should go down when you do that. Some people are naturally withdrawn. When you come around, they go down, and that's a plantar reflex. Okay. Kishan, can you turn over onto your front? So yeah. You've done all, okay, so you're going to go on your front, like that. Okay. When you do this, okay, now, you have access now, all the way up the back of his calf, thigh, backside, even back of the spine if you're going to go up there, okay? So if you look at this, is the S1 dermatome here. Do you feel me touch at the back here? Mm-hmm. S2 at the back here, yep. Okay? S3, it's the major part of the buttock here. If you're going to get personal, inner part of the buttocks S4 and around the anal ring is S5, okay? Now, here's the thing. If you think you have somebody with maybe you have cauda-equina problems or symptoms, or even a cord problem, you've got to examine that, okay? And if you think, if
I don't.
we're not going to do it to poor Kishan here, okay, at the moment. But usually the best way to do that is usually with the patient lying on their side, okay? Because usually you end up with a PR anyway, and what you're looking for in a PR is the anal tone when you pop the finger in, because everybody sticks a finger up your backside, it's going to contract anyway, okay? 1, do they feel it? 2, does it contract? And then 3 is motor contraction, can they actually contract any finger? So that's what you're looking for. So that's a different thing. Now, you can do your femoral stretch, can't you? So look, it's quite easy. Literally just a couple of fingers, up she goes like that. And what you're asking for is, do you get any pain coming down the front of your leg? And then you ask about the character of it. So if this is an L4 nerve root problem, I expect not just here, but also down here as well. Is that like the pain they experience in life? You can accentuate it by lifting the leg back. Okay, quite easy to do, and then do the other one as a comparator like that. Okay? And that's basically me done. I've put him through enough. Right, thank you, sir.
Cheers.
Okay.
Can we do some reflexes? Like, do you guys have problems with reflexes, like as med students? Because we have
no.
proper tendon hammers, and if you want to,